The politician who voted to cut healthcare funding for the poor never imagined he'd need charity care himself. But when he collapsed at a campaign rally, the only doctor available was the uninsured kid whose family he had failed 20 years ago. Dr. Elena Martinez wiped the sweat from her forehead as she finished stitching up her 15th patient of the day. The cramped examination room at the community health center was sweltering in the summer heat, the ancient air conditioning unit having given up weeks ago. But Elena had long since stopped noticing the discomfort. For her, this free clinic in East Los Angeles wasn't just a workplace. It was a mission, a promise kept to a mother who had died too young and too poor. At 34, Elena was one of the most dedicated physicians at the clinic, working 60-hour weeks to serve patients who had nowhere else to turn. The uninsured, the undocumented, the forgotten. They all found their way to her door. She spoke to them in Spanish and English, sometimes a mixture of both, understanding not just their medical needs, but the fear and shame that came with being unable to afford basic health care. What her patients didn't know was that she had once sat in their shoes, clutching a parent's hand in a hospital waiting room, watching staff turn them away because they lacked the magic piece of plastic that determined who lived and who suffered in America. Elena's story began 22 years ago in this same neighborhood. She was 12 years old when her mother, Carmen Martinez, first started complaining of chest pains. Carmen worked 3 jobs, cleaning offices at night, washing dishes during lunch hours, and taking care of elderly neighbors on weekends, all to keep food on the table and a roof over their heads. Healthcare was a luxury they couldn't afford. The family had no insurance. Carmen's employers classified her as a part-time contractor at each job to avoid providing benefits. When the chest pains became unbearable, Carmen would take over-the-counter medications and continue working, afraid that missing shifts would mean eviction. Elena remembered the night everything changed. Carmen had collapsed while cleaning an office building downtown. A security guard called an ambulance, and Elena met her mother at Los Angeles General Hospital. The emergency room was packed with people like them, the working poor, the invisible population that kept the city running, but couldn't access its most basic services. They waited for 7 hours before a doctor could see Carmen. The diagnosis was a heart attack, not her first, they learned, but a significant one that required immediate cardiac catheterization and possible surgery. The cardiologist explained the procedure in clinical terms, then asked about insurance. When Elena's father, Miguel, admitted they had none, the entire conversation changed. The necessary procedure would cost $40,000 up front. The hospital's financial aid office could schedule an appointment for next week. Meanwhile, Carmen needed to be stabilized and transferred to the county hospital, which was already overcrowded and understaffed. But she needs surgery now, 12-year-old Elena had pleaded, not fully understanding the system that was failing her family, but sensing its cruelty. "I'm sorry, sweetheart," the doctor had said, his voice genuinely pained. "We can't perform elective procedures without payment arrangements." Elena would never forget the word elective. Her mother's life-saving heart surgery was classified as elective because it wasn't immediately fatal, never mind that delaying it was a death sentence. Carmen Martinez died 3 weeks later in the overcrowded county hospital, waiting for a surgery that could have saved her life. She was 38 years old. The cause of death was officially listed as massive myocardial infarction, but Elena knew the real cause, a healthcare system that valued profit over people. The funeral was held at the small Catholic church, where Carmen had prayed every Sunday, asking God to keep her family healthy because they couldn't afford to be sick. The priest spoke about God's plan and eternal rest, but Elena felt only rage at the system that had killed her mother, at the politicians who designed it, and at herself for being too young and powerless to save the most important person in her world. That rage became fuel. Elena threw herself into her studies with the intensity of someone who understood that education was her only weapon against the system that had destroyed her family. She excelled in high school, earning scholarships that made college possible. Pre-med courses, MCAT preparation, medical school applications. Each step was taken with the memory of her mother's final days driving her forward. Medical school was grueling, but Elena had advantages that her professors didn't recognize. She understood illness from the patient's perspective, knew the fear that came with medical bills, and had witnessed firsthand how quickly healthcare debt could destroy a family. When her classmates complained about challenging patients, Elena saw people like her parents, hard-working, dignified individuals failed by an indifferent system. During her residency at UCLA Medical Center, Elena made a decision that surprised her colleagues. Instead of pursuing a lucrative specialty, she chose family medicine with a focus on underserved populations. Her professors warned her about the financial implications. Family doctors serving low-income communities would never achieve the wealth and status of specialists in affluent areas. "Money isn't why I became a doctor," Elena would tell them, thinking of her mother's memorial fund that had helped pay for her education. After completing her residency, Elena had multiple offers from private practices and hospital systems. Instead, she chose to work at the East LA Community Health Center, the same clinic that had tried to help her mother years after it was too late. The salary was a fraction of what she could earn elsewhere, but the work was exactly what she had trained her entire life to do. The clinic served everyone regardless of their ability to pay. Elena treated construction workers with back injuries, restaurant employees with burns, children with asthma, and elderly patients managing diabetes on fixed incomes. She wrote prescriptions knowing her patients would need to choose between medications and groceries. She referred people for procedures they couldn't afford, then helped them navigate charity care applications and payment plans. But Elena's work extended beyond the examination room. She testified before the city council about public health needs, organized health fairs in underserved neighborhoods, and trained community health workers to extend care into areas where people feared seeking help. She had become the kind of advocate her mother had needed but never found. The clinic operated on a shoestring budget, relying on federal grants, private donations, and the dedication of staff who could earn more elsewhere but chose to serve their community instead. Every year brought new challenges as political winds shifted and healthcare funding became a political football. The latest threat came from Congressman Robert Blackwell, a conservative politician who had built his career on fiscal responsibility and limited government. Blackwell represented a district that included some of the wealthiest neighborhoods in California, but his policies affected the entire region. He had been a vocal opponent of healthcare expansion, arguing that free clinics like Elena's created dependency and discouraged personal responsibility. During his most recent campaign, Blackwell had specifically targeted community health centers, claiming they were wasteful government spending that enabled illegal immigration and discouraged people from finding real jobs with benefits. His proposed legislation would eliminate federal funding for clinics serving undocumented patients and impose strict income verification requirements that would effectively shut down facilities like Elena's. People need to take responsibility for their own health care, Blackwell had declared during a television interview. We can't keep throwing taxpayer money at problems that should be solved by personal responsibility and free market solutions. Elena had watched that interview with the same rage she had felt as a 12-year-old, watching her mother die. She had written letters, organized petition drives, and even testified before congressional committees about the real-world impact of such policies. But politicians like Blackwell lived in a different world, surrounded by people who had always had access to the best healthcare money could buy. The irony was not lost on Elena that Blackwell's proposed cuts would primarily affect working families, people like her parents who worked multiple jobs but still couldn't afford health insurance. These were not lazy individuals seeking handouts. They were the invisible workforce that cleaned Blackwell's offices, served his meals, and built his houses. On a sweltering Tuesday in July, Elena was treating her usual stream of patients when chaos erupted outside the clinic. She heard sirens and shouting, then saw a crowd gathering around someone who had collapsed on the sidewalk. Through the window, she could see a news van and people in expensive suits, unusual for her neighborhood. Elena grabbed her medical bag and rushed outside. A man in his 60s lay unconscious on the concrete, his face grey and sweaty despite the heat. Around him, staffers and reporters were shouting into phones, calling for ambulances and trying to clear space. "What happened?" Elena asked, kneeling beside the man and checking his pulse. "He just collapsed during his speech," a young woman in a campaign t-shirt explained. One minute he was talking about budget responsibility, the next he was on the ground. Elena looked at the man's face and felt her stomach drop. Even unconscious and vulnerable, she recognized Congressman Robert Blackwell, the politician who had made a career of attacking everything she represented. His pulse was weak and irregular, his breathing shallow. Classic signs of cardiac arrest. Elena immediately began CPR while instructing bystanders to call 911. But as the minutes ticked by with no ambulance in sight, she realized the nearest hospital was 20 minutes away in traffic, and Blackwell's condition was deteriorating rapidly. "We need to get him inside," Elena announced. "I have equipment at the clinic that can stabilize him." The campaign staffers looked confused. "Isn't there a real hospital nearby?" one of them asked. "I am a real doctor," Elena replied firmly, "and right now, I'm his best chance." With help from several bystanders, they carried Blackwell into the community health center. Elena's staff, accustomed to emergencies, quickly cleared an examination room and brought out their crash cart, donated equipment that was older than what wealthy hospitals used, but still functional. As Elena worked to stabilize Blackwell, she couldn't help but think about the bitter irony of the situation. Here was a man who had spent years arguing that people like her parents didn't deserve access to healthcare, now completely dependent on the kind of clinic he wanted to shut down. She started an IV, administered medications to stabilize his heart rhythm, and prepared him for transport to a full-service hospital. Throughout the process, she maintained complete professionalism, treating him with the same care she would give any patient. Her oath as a physician transcended politics. When the ambulance finally arrived, Blackwell was conscious and stable. As the paramedics prepared him for transport, he looked at Elena with confusion. "Where am I?" he asked weakly. "You're at the East LA Community Health Center," Elena replied. "You had a heart attack during your campaign rally. We've stabilized you, but you need to get to a cardiac unit immediately." Blackwell's eyes widened as he processed the information. Even in his weakened state, he understood the implications of being saved by the kind of facility he had spent years trying to defund. The story hit the news within hours. Footage of Congressman Blackwell being treated at a community health clinic spread across social media with headlines like "Anti-Healthcare Politician Saved by Free Clinic" and "Congressman Learns Value of Community Healthcare the Hard Way." Elena tried to avoid the media attention, but reporters found their way to the clinic. She agreed to one brief interview, choosing her words carefully. "We treated Congressman Blackwell the same way we treat every patient who comes through our doors," she told the local news station. "Healthcare shouldn't be a political issue. When someone is dying, you don't ask about their insurance status or their voting record. You save their life." But the reporter wanted more context. "Dr. Martinez, our research shows that your own mother died waiting for cardiac care at a county hospital. How did it feel to save a politician who has worked to limit healthcare access for families like yours?" Elena paused, feeling the weight of that 12-year-old girl's grief and the adult woman's commitment to healing. "My mother died because she couldn't access timely cardiac care. Today, I was able to save someone's life because this clinic exists. That's exactly why we do this work, so that no family has to go through what mine did, regardless of who they are or what they believe." The interview went viral. Elena's story, the uninsured girl who became a doctor dedicated to serving others, resonated with people across the political spectrum. Messages of support poured in from around the country, along with donations to keep the clinic running. But the real change came from an unexpected source. 3 days after his heart attack, Congressman Blackwell asked to meet with Elena privately. He arrived at the clinic during evening hours, avoiding the media attention that had surrounded his medical emergency. Elena found him in the waiting room, looking smaller and more vulnerable than his television appearances suggested. "Dr. Martinez," he began, his voice still weak from his ordeal. "I wanted to thank you for saving my life. But more than that, I wanted to understand what you do here." Elena gave him a tour of the facility, showing him examination rooms where uninsured families received care, the pharmacy that provided medications at cost, and the community outreach programs that brought healthcare to people who might otherwise go without. She introduced him to patients who shared their stories, working people who fell through the cracks of the healthcare system despite their best efforts. "This is Maria," Elena said, introducing Blackwell to an elderly woman waiting for her diabetes checkup. She worked as a hotel housekeeper for 30 years but never received benefits. Without this clinic, she would be managing her diabetes with emergency room visits that would eventually bankrupt her and provide worse care. Blackwell listened as Maria explained, in broken English, how the clinic had not only managed her diabetes, but helped her daughter get prenatal care that ensured a healthy pregnancy. Room by room, patient by patient, Elena showed Blackwell the reality of healthcare in America, not the theoretical debates of congressional hearings, but the lived experience of people who worked hard but still couldn't afford basic medical care. "I had never thought about it this way," Blackwell admitted as they sat in Elena's small office. "In Washington, we talk about healthcare in terms of budgets and policies. I never considered the human cost of the decisions we make." Elena could see that his heart attack had shaken more than his cardiovascular system. Coming so close to death, being vulnerable and dependent on others, had given him a perspective that years of political rhetoric had obscured. "Congressman," Elena said gently, "the people we serve aren't looking for handouts. They're working people who deserve access to basic health care. My mother worked 3 jobs and still couldn't afford to see a cardiologist when she needed one. The difference between life and death shouldn't be determined by insurance status. Over the following weeks, Blackwell became a regular visitor to the clinic. He attended community meetings, spoke with patients, and observed the daily operations of a facility he had once dismissed as wasteful government spending. Each visit challenged his assumptions about poverty, healthcare, and the role of government in addressing social problems. The transformation was gradual but undeniable. The man who had built his career on opposing healthcare expansion began to understand the complex reality faced by working families who couldn't access care. He saw that the clinic didn't create dependency. It enabled people to stay healthy enough to work and care for their families. 6 months after his heart attack, Congressman Blackwell introduced new legislation in Congress. Instead of cutting funding for community health centers, his bill proposed expanding access to preventive care and creating pathways for working families to obtain affordable health insurance. "I learned something important about healthcare this year," Blackwell told his congressional colleagues during the floor debate. "It's not a political issue or an economic theory. It's about human dignity and the basic right to receive medical care when you're sick. I nearly died this year, and I was saved by the kind of clinic I had spent years trying to shut down. That taught me that good healthcare policy isn't about ideology. It's about ensuring that every American can access the care they need to live healthy, productive lives." The legislation faced significant opposition from Blackwell's own party, but his personal testimony and Eleanor's clinic became powerful symbols of healthcare reform. The bill eventually passed with bipartisan support, providing increased funding for community health centers and expanding insurance options for working families. Elena testified before Congress in support of the legislation, telling her mother's story and explaining how community health centers served as safety nets for people who fell through the cracks of the healthcare system. She emphasized that these facilities didn't just treat illness, they prevented more serious conditions through early intervention and preventive care. "Every patient we see at our clinic represents someone who might otherwise go without care," Elena told the legislators. "When we treat a diabetic's infection early, we prevent an amputation. When we provide prenatal care, we ensure healthy babies. When we manage hypertension, we prevent heart attacks and strokes. This isn't just compassionate policy, it's economically smart." The day the legislation was signed into law, Eleanor received a call from Congressman Blackwell. He wanted to return to the clinic, not as a patient this time, but as a supporter celebrating a victory for community healthcare. At the small celebration held in the clinic's waiting room, Blackwell addressed the staff and volunteers who had dedicated their lives to serving their community. "Dr. Martinez saved my life twice," he told the gathering. "Once when I had a heart attack, and again when she opened my eyes to the reality of healthcare in America. She showed me that the measure of a society isn't how it treats its wealthiest citizens, but how it cares for its most vulnerable." Elena thought about her mother as she listened to Blackwell speak. Carmen Martinez had died believing that her family didn't matter to the powerful people who made decisions about healthcare. But her daughter had proven that every life has value, that every patient deserves dignity, and that sometimes the most powerful form of advocacy is simply doing the work of healing. Years later, Eleanor would tell her medical students that the most important lesson she learned as a doctor wasn't taught in any classroom. It came from understanding that healthcare is fundamentally about human connection. The recognition that every patient, regardless of their circumstances, deserves compassionate care. The clinic continued to grow, serving more patients each year as funding increased and public support expanded. Elena never left, despite offers from prestigious hospitals and research institutions. Her work remained what it had always been, a promise to her mother that no family would face the choice between medical care and financial survival. And Congressman Blackwell, who had entered the clinic as an opponent of everything it represented, became one of its most dedicated advocates. He learned that true leadership sometimes means admitting when you're wrong and working to make things right. The politician who had once voted to cut healthcare funding for the poor discovered that charity isn't weakness. It's the foundation of a compassionate society. And the uninsured girl who had watched her mother die became the doctor who proved that healing extends far beyond medicine, reaching into the realm of policy, politics, and the fundamental question of what kind of society we choose to build. Sometimes the most powerful medicine isn't found in a prescription bottle. It's found in the courage to treat every person with dignity, regardless of their ability to pay. The girl who lost her mother to a system that failed the poor grew up to save the politician who had perpetuated that system. Because true healing happens when we choose compassion over ideology, when we see patience instead of politics, and when we remember that the measure of a society is how it treats those who need help the most. What if the person you're called to serve is the same person who made your struggle possible? What if your greatest enemy becomes your most powerful ally? Sometimes the most important surgery we perform isn't on a patient's body. It's on our own heart, removing the barriers that prevent us from seeing the humanity in everyone.